All right, I've reviewed my physician's orders, and I'm going to identify my patient by two identifiers, name and date of birth. Can you state your name and date of birth for me? All right. Today we're going to be suctioning your tracheostomy, and we're going to be cleaning the inner cannula. So first off, I'm going to start by suctioning the tracheostomy, and first I'm going to start by hyperoxygenating. All right. All right, I'm gonna lip this normal saline and then pour the normal saline into that cup. Now I'm going to wrap the cannula into my dominant hand. Alright, and then now with the suction at 120 to 150 millimeters of mercury, we'll connect it to suction. Alright, and now I'll do practice tests with the normal saline. Make sure my suction unit is working, and it is. Okay, now I will take this off with my non-sterile hand. Alright, now I'll be advancing the suction catheter in, not suctioning, until I meet resistance or the patient coughs, and then I will withdraw and intermittently suction. Alright, and now I'll clean the inner cannula in between suctions and hyperoxygenate in between suctioning. But the patient's sats have improved and her lung sounds are a lot better, so that will conclude her suctioning. And then we will hyperoxygenate. And then I'll dispose of this properly. Now the next step is to be cleaning her tracheostomy, so now I'll be using my clean gloves to take off the old dressing on the tracheostomy. Taking these gloves off and then performing hand hygiene. Now I'll be opening my tracheostomy care kit. I'd have to get a new tracheostomy set and set it up because of when that touched it. Get my sterile gloves. Before I don this sterile glove, actually what I'll do is I'll go ahead and pour my saline and hydrogen peroxide mixture into my big container, and then my normal saline container there. Now I'll don this sterile glove. Now I'll start off by removing the inner cannula with my now dirty hand. And letting it soak here into the hydrogen peroxide mixture. Now I'll clean it with this wire cleaner until I see that most of the mucus is gone. And now I'll let it soak in our normal saline solution. Dispose of that one properly. All right. Now what I'll do is dip it here in this hydrogen peroxide mixture, and then clean our base plate and suture lines. All right, now with my sterile hand, I will dry the inner cannula. Now I will place it back into the patient. All right, and now I will put a new clean dressing under the base plate, making sure not to dislodge it. And now I'll be placing new ties on it. As the patient said, not to make sure that there's any creases or any knots in the back. Make sure that the fit is snug but not too tight. All right. And now I'll dispose of all of my equipment and then document how the patient tolerated the procedure and my findings and perform hand hygiene.